As I stand here today to anchor this program, I'm reminded of the critical role maternal and newborn health care played in my own existence. My late mother, being a teenage bride due to early marriage in those days, had already lost her first son as a newborn, losing a brother I never met. You will understand when I say I owe my existence to the diligent care of medical professionals who ensured both my mother and my well-being during those fragile early days. The importance of quality healthcare during this period cannot be overstated. Not only does it save lives, it also sets the stage for a healthy future for the child and mother. Now, we all definitely understand why investing in maternal and newborn healthcare is crucial, as it directly impacts the well-being of families and communities worldwide. It is a lesson I live with every day. Welcome to 30 Minutes on NTA News 24. Yes, this edition is focusing on maternal and newborn health, a call for action. I'm Lydia Sampson. Our first report by Theresa Shonom chronicles the significance of the commemoration of the World Health Day annually and how various themes of the past celebrations have shaped healthcare and health policies outcomes. It highlights how the day focuses on critical health challenges through yearly themes, shaping healthcare policies and awareness worldwide.
Global health challenges are vast and pressing, with more health issues evolving due to humans' inaction and all actions. According to the World Health Organization, WHO, approximately 1 in 4 people worldwide are affected by mental health disorders, yet most lack access to necessary care. Climate change is also a growing threat, with studies showing that over 13 million deaths each year are linked to environmental factors.
There are many things that lead to climate change. Deforestation is one of them. That is cutting down the trees and burning grasses in the forest, exposing the soil to bear. We can do something about that. We can stop cutting trees down. We can stop using wood for firewood, which is one of the reasons why we cut trees down. We can stop this annual burning of bushes and allow the grasses and so on, shrubs to grow, so that the soil can become fertile for us to have good agricultural yields, and also for the temperature of the environment to be lower than what we are having now. The climate is changing, the temperature is rising, the water level, the sea level is rising and claiming more land than it used to be. And for lakes like Lake Chad, for example, it is drying up, which is not what we want. We used to fish from it, and we are still fishing, but the less the water, the less fish we can get from it. And when you have a place like River Chad Basin drying up, it means that the agricultural activities around Lake Chad would also be decreasing.
So if we have climate change as a theme, it's a wake-up call for us to look and see how we can adjust or react to that particular situation and ensure that climate change doesn't become a major challenge for us, because climate change happens to all countries. Some, of course, worse than others are dealing with very worse situations. You may talk about desertification, challenges with finding food or for harvesting crops, so people don't get enough nutrition. You can see how that begins to affect people's livelihood. So at any point in time, in every year, I think the key thing is for us to see that there is a challenge, even if it's considered a worldwide challenge, but see how we can domesticate that in Nigeria, see how we can begin to address issues.
Additionally, non-communicable diseases such as heart disease, diabetes, and cancer now count for over 70% of global deaths, with healthcare demands growing by the day. Access to basic healthcare remains out of reach for millions, especially in low-income countries. These statistics highlight the urgency of addressing global health challenges. Many of these issues, like mental health, climate change, and diseases, are not limited by boundaries crossing borders and affecting countries. Therefore, The world required coordinated global responses to create lasting solutions.
We need to make health accessible, affordable, and effective in its quality that is being provided to everyone, either you are in the rural or urban area. This particular day is a day that has a theme of healthy beginning and hopeful future. It reminds us of the need to ensure that the beginning of life is not only smooth, but is properly managed, from safe birth to lifelong well-being of everyone. The child that is recently born, the adolescent that is going into adulthood, the woman that is getting pregnant and about to deliver, the adult that is moving into elderly status, so that they also enjoy healthy aging in good health.
We in Nigeria have health care systems, health challenges, health promises, like any other country. If you want to know how Nigeria is faring compared to the rest of the world, we would want to look at the health indices, starting with infant mortality. At the moment, the Nigerian infant mortality rate is 55 per 1,000 live births. The African average is 42. The global average is 26. So you can see from 55 for Nigeria, that means that for every child that is born, the likelihood of that child dying before the child is 1 year old, that's what we mean by infant mortality rate. So the Nigerian figure is 55, African average is 42, global average is 26. So you can see that ours is worse than the African average and than the world average.
And ensure that vaccination for children is very, very critical to their health. So that one must be implemented. And also, honestly, I am a strong advocate of this Child's Right Act. If it is implemented, it will help reduce the challenges or health challenges of our children. Because their children are roaming the streets, you don't know what they eat, you don't know what they do, and they are mingling with people, you don't know the people they are mingling with. It affects their health. Therefore, we need to implement the Child's Right Act.
This is where initiatives like World Health Day comes in. Observed annually April 7th, World Health Day offers a platform to raise awareness among these pressing health issues and encourage action. Each year, World Health Day, WHO focuses on a different theme, from climate change to mental health, bringing global attention to problems that require urgent attention.
Because health is not only implemented at the national level, it is also implemented at the state level and at the local government level. And as a matter of fact, the people at the local government level have more to do than people at the center. The people at the center are supposed to set policies and guidelines and monitor how things are implemented. And people at the grassroots, especially at the local government level, are supposed to be implementing. And somehow, we're not doing enough of that. That's a challenge.
Everybody, everywhere, anywhere in the world should have access to safe, effective, and efficient healthcare delivery. And this is just one of them. And they constantly remind us if there is need for policy shifts, policy changes, or refocusing of what we are doing, how effectively is it serving the people. And this is what all these days tell us. If we are, and also gives an opportunity for us to showcase what we are doing well, remind us of the need to improve on what is not providing the right results, and also to look into what needs to be shared with other climes where certain practices are producing good results.
Health is an outcome to everything we do. And I'd like to commend the Nigerian government for taking the stage to really initiate action to accelerate reduction of maternal and neonatal mortality.
Governments across the world and the private sector play strategic roles in addressing global health challenges by formulating public health policies and ensuring healthcare access, funding necessary infrastructure towards improving health outcomes. In Nigeria, government has introduced several initiatives, including the National Health Insurance Scheme, to streamline the delivery of primary healthcare services.
Every year, we remind ourselves, share experiences, share good practices, evidences across the world on how to do things better. Nigeria has its own health challenges. Other countries do have theirs, but the ones that are similar, we learn from ourselves. What have they been able to do to make it better for their people that we can learn from, just like they also learn from us. How we're able to tackle Ebola, how we're able to also overcome COVID-19 is a lesson for the world.
Ultimately, the fight for global health is a shared responsibility. World Health Day serves as a reminder that our health is interconnected, and only through working together can the world create a healthier, more equitable future for all.
The second report by Thomas Ogbetere focuses on this year's theme of World Health Day, healthy beginnings and hopeful futures. It also emphasized why maternal and newborn healthcare are a cornerstone for global well-being. He has more on this year's campaign led by the World Health Organization, underscoring the urgency of addressing preventable maternal and newborn deaths. Over to Thomas for his finding.
This year's World Health Day, with the theme Healthy Beginning, Hopeful Futures, is shining light on the critical importance of maternal and newborn health. The World Health Organization (WHO) is taking the lead, as always, in highlighting the urgent need to address preventable maternal and newborn death, which is needlessly claiming nearly 300,000 women and over 2 million infants annually due to sometimes avoidable complications during pregnancy or childbirth, meaning most families globally have experienced the loss of loved ones to maternal and newborn health, especially in Africa. Naturally, experts, including the Special Advisor to the President on Health, Dr. Salma Ibrahim Enas, agreed that the theme is apt.
When you have a healthy mother, you have a healthy newborn, it's a new beginning. Everybody is happy, everybody celebrates, and we sustain that. And that is the hope for the future. That is the next generation that is coming up. A mother is healthy, she's alive, she raises the child, because a lot of evidence have shown that mothers that die as a result of pregnancy and childbirth, even if the child survives, the child go through a lot of health problems, including psychosocial and mental problems. So we need to focus at the beginning, pre-pregnancy, so that the woman is well informed about pregnancy and is well prepared for pregnancy. And throughout the duration of pregnancy, the mother is well taken care of through the antenatal clinic. And then during delivery, at the point of labor, at the point of delivery, the woman have access to quality healthcare services.
No matter what we do, how many roads we have, how much growth we have per capita in GDP, I think if we're losing the number of women that we're losing, I think that's not optimal. So from the government side, I can assure all of you that President Tinubu is very committed to this, and we that are working for him, doubling all our efforts, and we appreciate all the partners that have shown up.
Maternal mortality rates in the country, as at 2023, we were ranking second. It's very abysmal, despite all the efforts being put in. As at 2025, we're around the third, and that's still very bad. So focusing on maternal and newborn health in this World Health Day is really, really important.
Although the numbers are staggering, experts have the view that improved access to quality healthcare services, safe delivery practices, and enhanced postnatal care can significantly reduce these preventable tragedies. Governments and healthcare organizations are therefore urged to prioritize women's long-term health and increase efforts to eliminate this unnecessary death.
Because we want a collective investment in the health of mothers and also the health of our children so that they have a new and a good beginning that gives us hope for a better future and a better Nigeria. And I can tell you, this fully aligns with the aspirations of His Excellency President Bola Ahmed Tinubu.
NPHCDA, under the leadership of President Tinubu and the Coordinating Minister for Health, Mohamed Ali Pate, is working with Federal Ministry of Health, the National Health Insurance Authority, other health MDAs and partners in the implementation of our flagship national effort to rapidly crash maternal mortality.
And it's not just the government, it's a collaborative effort. So even private individuals, that's another thing I find that is a problem for us in Nigeria. So you find people who can sponsor, philanthropists, they don't put money into health. They would rather put money into other things that are not really as beneficial as us having a healthy populace.
Healthcare professionals are on the same page that this campaign is both timely and crucial as global health systems strive to recover lost progress in maternal care. They acknowledged by leveraging health data and fostering international collaboration, WHO aims to ensure healthier outcomes for mothers and babies worldwide.
Most of the challenges that happen as a result of low demand for services, they are as a result of lack of awareness. People are not aware of the benefits, of the consequences of not accessing the services. So we must invest in health education. We must invest in health promotion and lifestyle adoption. So when it comes to maternal health, it does not start when the woman is pregnant. It starts the day that the child is born, following the immunization, following the nutritional support, and following what we call sexual and reproductive health education for both boys and our girls. The mothers, the parents must be educated on sexual and health education. When is the right time to get pregnant? You have to prepare for it. You don't just get pregnant and say you are pregnant by accident and you don't know what to do about it.
So it's important that there's that community-based partnership. How would that occur? If, for instance, in a community, the head, maybe that they have an Oba, you go there and introduce yourself to the Oba and you're like, okay, we are here to see what we can do to help improve our maternal mortality rate. We don't want our women dying while giving birth. We don't want our newborn children dying, because newborn death rate is when you have a child dying within 28 days of delivery. So you talk to him and then he knows how to get his the community, and maybe you can have access to now talk to the people.
They also believe promoting education and awareness campaigns to empower communities with knowledge about maternal and newborn health will not only be game-changing, but also life-saving. This is by providing information on the importance of safe delivery practices and postnatal care.
We are part of a global commitment and declaration. We have committed to ensure that all Nigerians under this administration of President Bola Ahmed Tinubu attain universal healthcare coverage. No one is left behind. And this is a global commitment. We are committed to the Sustainable Development Goals that are specifically focusing also on the health of women, the rights of women, the rights of children and girls.
That's why it's so important to make sure that you educate the woman, the girl child. Because when you educate the girl child, she's going to have children at some point, and it is the knowledge she has she's going to impact in those children. So it's so important that it's in the long run, it would also affect the maternal mortality rate and death rate, and then the newborn death rate.
Experts are categorical that the World Health Day serves as a reminder of the importance of solidarity in tackling global health challenges. With countries and communities working together, the world can lay a solid foundation for a brighter future for families everywhere.
You know, it requires multi-sectoral approach, multidisciplinary approach, you know, and diversity in terms of addressing. Because if I may take one of the challenges, which is around socio-cultural behaviors, you know, and the norms of our societies, which includes religious norms and cultures that affect uptake of the services. So those are things that cannot be addressed by government alone. It requires working with communities, community leaders, traditional institutions, also enlightenment campaigns, and working together with religious leaders, because they play a very significant role in influencing. In my work, which I've done so several years in the area of maternal and child health, you will hear a lot of religious leaders, due to lack of knowledge, saying that, well, my mom has had like 10 to 12 children and she survived it, and then my grandmom has. So, but we need to work together with them to have a better understanding so that we can improve access to services and also change these behaviors. Because they also need to know that early pregnancies in a girl as a result of early marriage, you know, it's a very risky pregnancy if a girl is underage, before the age of 18, where she's so immature. And also late pregnancies in a woman that is elderly. We term even 27 years pregnancy as an elderly pregnancy. It's a high-risk pregnancy.
2,193 skilled birth attendants have been engaged to provide safe services in PHCs by the states and the federal government. 862 primary healthcare centers have been fully revitalized, and another 2,419 are in the process of being revamped. 60,470 frontline health workers have been retrained in integrated primary healthcare services, and the number of women that have accessed antenatal care in our facilities have doubled in this period.
We must acknowledge that governments across the region have been doing a lot to reverse the trends of slow maternal mortality ratio decline. Going forward, we advocate that government improve access to essential services. They pay a lot more focus on not just access, but quality services in health facilities, and they also protect the rights of women. This is very important and crucial.
Another essential aspect of the WHO campaign is the focus on the role of nutrition and preventive care in maternal and newborn health. Experts stress that adequate nutrition before, during, and after pregnancy is crucial to reducing risk for both the mother and infants. Similarly, access to vital vaccination, medication, and screening can provide a strong foundation for healthy beginning.
On the health sector, there are also important things that needs to be done in the social determinants of health, because not just interventions in health are necessary to bring down maternal mortality ratio. For women to access hospitals, they need good roads, they need good transportation services. We need to break barriers around some social and cultural norms.
A lot of things are being put in place now to help reduce maternal mortality. Now, over 154 health centers have been identified for emergency obstetric care. So a woman in labor, there's no money, please, they should go to such hospitals. They can check online. There's a list of, and most of them are teaching hospitals, federal teaching hospitals, and even some other state hospitals in everywhere in the 36 states, plus the FCT. So I want to use this opportunity to say that you are not just without help. So a lot of things is being put in place even by the government of the day to see how there will be improvements in the health of our mothers, and we now reduce the maternal mortality rates and the newborn death rates.
Because you need to have the services immediately, and there's what we call the emergency obstetric care has to be available. Then the basic obstetric care.
Now you understand why the World Health Day campaign is a critical reminder of the importance of prioritizing maternal and newborn health. By working together and leveraging open health data and international collaboration to ensure healthier outcomes for mother and babies worldwide.
Every life today owes a debt to quality maternal and newborn care. Of course, as a religious country, God is surely a great part of our existence. That is why God gave us knowledge to help us prioritize humanity. Therefore, let's unite to support maternal and newborn health services, ensuring every birth is a celebration of life and health. Together, we can safeguard the future by protecting the most vulnerable moment of human existence. Thanks for watching. God bless. I'm Lydia Samson.